everyone, I'm Ashley.
And I'm Liza.
And this is our informational video on obesity.
We have interviewed a surgeon, a personal trainer, and a Zumba instructor.
The surgeon informed us about possible options to control obesity. The personal trainer talks about her availability to students at Penn State Lehigh Valley. And the Zumba instructor introduces a fun new way to enjoy exercise.
I'm Keith Kreitz. I'm a physician with Mercy Healthcare System. That's my clinical appointment. My academic appointment is I'm an assistant clinical professor of surgery with the University of Pennsylvania Health System. Okay, well, first thing is that there are actually 4 surgeries out now that we do for weight loss. Gastric bypass is the most prevalent. 2 others that I do are lap, adjustable gastric banding, as well as gastric sleeve. A 4th one that's done at fewer centers is called a BPD, and that's a very large operation that also has a restrictive and malabsorptive component. But really, everybody who goes on to surgery actually has to have tried non-surgical weight loss first and failed, meaning they have to have done some sort of regimented dietary intervention, preferably physician organized or overseen, preferentially with a dietitian. Okay, so gastric bypass surgery is where we've taken the front part of the stomach and we've divided it off from the rest of the stomach. This stays in, this doesn't get removed, and then what happens is we divide the intestine at a point downstream that we determine based upon how much weight we want the person to lose, and we pull that intestine up past that old part of the stomach called the remnant and plug it into this little front pouch. And what we basically do is they have a restrictive component, meaning this little front part of the pouch only holds about 15 to 30 cc's of food when you eat. So you eat a little bit, you get early satiety, meaning and you feel full early in the meal. So patients either have to be 100 pounds over their ideal body weight, or they have to have a body mass index of 40 or greater, or 35 and comorbidities. That means that if you have high blood pressure, diabetes, sleep apnea, and you have a body mass index of 35, you're a candidate. Or if you don't have those, and you're 40 BMI, then you'd be a candidate. So complications are early and late ones. So early complications are usually related to surgery. They can get a leak from where you've cut things apart, put them back together. They can get clots in their legs called deep venous thromboses. Those can break off and go to their lungs, give you a pulmonary embolus, and can kill someone. You can get loss of your pulmonary reserve, which means your lungs kind of shrivel down a little bit. You get atelectasis. And late complications with gastric bypass, where you hook the little part of the stomach up to the small intestine, that little area has staples there, and it can become very sensitive, and it can actually stricture down and get narrowed. Okay, so probably the best ways to find a surgeon who's experienced in doing this is, number one, there are a number of websites. Obesity Help, obesityhelps.com is one. If you go to any of the surgical manufacturers like Covidien or Ethicon, they actually have websites such as realizemysuccess.com. Usually physicians will be listed on those websites. The physicians that are listed there usually have a proven track record, and they cannot get admitted to those websites until they have done a certain number of cases that have been proctored. Okay, the first thing to understand about obesity surgery is it doesn't happen in a vacuum. Everybody who goes on to surgery has to have a psychiatric evaluation. Additionally, if they have any heart issues, they have to go to the cardiologist. Most of these patients have diabetes as well, so they usually see the endocrinologist. And after they've had all these evaluations, the patients still have to meet previous patients to understand what they're getting into. And we usually do that through a support group and through information seminars. Okay, well, the first thing that people should know who are looking for a solution to their obesity, and this is coming from a surgeon, is that surgery is the option of last resort. There's a whole spectrum of things that people need to consider before going to surgery, but really they have to try the non-surgical options first. Diet, exercise, behavioral therapy, as well as there are medical therapies at this point. Some pills, the data is not good, but what we see is about 95% of people who actually try these non-surgical therapies still wind up maintaining weight that would make them require having surgery at some point.
Hi, I'm Cheri, and I'm the personal trainer at Penn State. Hi, it's available to Penn State students for free and also to faculty at the charge. I'm here on Tuesday nights from 6 to 8 and on Fridays from 12 to 2. And then I correspond with them through email or text messaging or phone calls whenever they need more help. It depends on what their goals are. Some want to run their first 5K, some want to do triathlon, some want to lose weight, some want to tone up. So we do all different kinds of circuit training or cardio training or kickboxing. So depending on the goals. Basically, just there's a lot of different websites out there that have nutrition like menus for the week. So whenever I find something, I'll email it to this.
Hi, my name is Olivia. I'm the Zumba instructor here at the Shrine Community Center, and I'm also a full-time high school math teacher. So Zumba is one of the best ways to exercise, I think. It was started as a Latin-inspired dance aerobics class. So a lot of the moves incorporate Latin dances like salsa, merengue, cumbia, reggaeton, a samba. So the moves are very fun and they make you feel very Hispanic, but the music is also just out of this world awesome. You can't just help but get up and want to dance, and it's fun, but it's very athletic, very aerobic, very good for your heart, so it's a wonderful way to exercise. There is lots of information about Zumba at the website, which is www.zumba.com, and you can find classes all over the country. If you go to find a class, at the top of the page you can insert a location, a city, a state, an instructor's name if you know them, and you can find a list of all the classes that are available. And the price depends on where the class is. Like here, the rates are $5 to drop in, or you can buy a Fit Pass for $40 a month, which would get you unlimited Zumba classes, which is the best. And most of the classes are the same because we all get choreography every other month with songs and moves that we're supposed to use. Of course, you put your own spin on it, so some of the instructors might be different if you went to a different location, but for the most part, Zumba is just a way of exercise, and it's awesome no matter where you go.
Una vaina que me sube,